Well, UNAIDS has launched its 2025 Global AIDS Update, which shows that a historic funding crisis is threatening to unravel decades of progress unless countries can make radical shifts to HIV programming and funding. The report highlights the impacts that the sudden, large-scale funding cuts from international donors are having on countries most affected by HIV. Yet, it also showcases some inspiring examples of resilience, with countries and communities stepping up in the face of adversity to protect the gains made and drive the HIV response forward. Now, the 2025 SA AIDS Conference Scientific Program Committee member, Dr. TendesayiKufa-Chakezha, joins us now for more. Dr. Tendesayi, a very good evening to you. Thank you so much for joining us. Welcome to the late edition.
Hi, good evening. How are you?
Very well. Good to have you on the show. First of all, Dr. Chakezha, how would you summarize the most critical findings of this UNAIDS Global AIDS Update for South Africa and the broader Southern African region?
So thank you so much for having me. This report is coming at a very critical juncture. You know what's happening with the funding situation with the program. The report says that we've been making a lot of progress in reducing new infections, in reducing deaths, and in keeping people alive. So there's been an increase in the number of people living with HIV, a reduction in the number of deaths compared to 2010, and a reduction in the number of new infections. I think it was 53% or something like that, around 50% the reduction in the number of new infections. But all of that progress that we have been making as a country is now at risk of, we're now at risk of reversing the gains that we have made because of the issues around funding the HIV response, with withdrawal of the PEPFAR funding and reduction in funding by other donors.
And given your role in the Scientific Program Committee, what aspects of the report stood out to you and for you as the most urgent for research, for programming, for implementation focus?
So what stands out is the need to continue strengthening prevention. So from where we sit, we know that the bulk of the prevention program in South Africa and in sub-Saharan Africa was largely donor funded. So governments do fund quite a bit of prevention efforts, but a lot of prevention work, especially for key populations, were donor funded, and that funding is going away. And we know that key populations, although they are small in number, when we talk about key populations, we are talking about populations whose HIV prevalence or the number of new infections that they experience or their risk of acquiring HIV is higher than compared to the general population. So in our settings, we are looking at female sex workers, we look at men who have sex with men and transgender women, we're looking at adolescent girls and young women and other mobile populations. So with the reduction in funding, a lot of key population programs suffered more, perhaps disproportionately more compared to other groups. And so we do need to rally around these programs, strengthen them, and learn best practice from others at the conference and in the months and years to come, so that we do not lose the gains that we had made in preventing HIV among key populations.
Yeah, and I see that the report warns of a historic funding crisis threatening decades of progress, as you just alluded to. Let's talk about what some of the specific risks this pose for South Africa's HIV prevention, treatment and care programs if such radical funding shifts are not made soon enough.
Yes, so as I was saying, that for South Africa specifically, the Department of Health has done a very good job of buying medications. So the bulk of the antiretrovirals that are bought in South Africa and used by people living with HIV are bought by the department. But the PEPFAR money paid for additional staff, they paid for counselors, they paid for peer workers, say in the key population programs. And a lot of these programs were delivered outside of the health facilities in order to get around the issues of stigma that populations experienced when they're coming to facilities. So it is those additionals, those things that made program delivery easier and more effective, that are at risk of going away. PEPFAR funding also funded a lot of data people, data clerks, and data officers in different places, and that also threatens our ability to continuously monitor the program and glean insights from what is happening. So those things need to be strengthened. They needed to be strengthened then, and more so now when we are running the risk of losing our funding.
All right, Dr. Tendesayi, great chatting to you. Thank you so much for joining us. We do appreciate your time. Well, I guess, I guess what's key is the role that the private sector or the innovative financing mechanisms should play in plugging these funding gaps. We just spoke to Dr. Tendesayi, who is the 2025 SA AIDS Conference Scientific Program Committee member, virtually to talk about this.